Next, we will discuss atrial fibrillation. Here's a diagram of the atrial fibrillation. You can see here the atrium, the right atrium and the left atrium is fibrillating, and there's an irregular ventricular contraction. So the atrial fibrillation, the origin of arrhythmia is from the right and or left atrium. It's suggested to be due to multiple wavelets of re-entry, and the atrial rate is typically 300 to 600 beats per minute. And it's random chaotic rhythm with atrial quiver and associated with irregular ventricular rhythm. So again, there's no uniform atrial depolarization. The atrium is just fibrillating. There's no contraction of atria as a whole. There's unorganized rapid electrical signals in atria, and you cannot see any P wave or definite P wave in the electrocardiogram. It can be paroxysmal, persistent, or permanent. For the ventricular rate in atrial fibrillation, it's the number of chaotic fibrillating waves transmitted and conducted through the AV node to the ventricle. It usually appears irregular, and the R wave amplitudes also varies irregularly. Here is two examples of atrial fibrillation. The upper one is atrial fibrillation with a slow ventricular response. You see here the ventricular rate is very slow, less than 60 beats per minute. But sometimes the atrial fibrillation can be sent with a fast ventricular response. You see here the ventricular rate is much faster than the upper one. There are also more examples of atrial fibrillation. You see here different examples, and sometimes the atrial fibrillation may appear as a combination of atrial flutter and atrial fibrillation, so-called a flutter fibrillation, as we described before. How about the treatment for this commonest arrhythmia? Pharmacological therapy is still the mainstay of therapy. We can use drugs to prevent the onset or to slow down the ventricular rate. We can perform radiofrequency ablation. We can ablate the AV node and then put the pacemaker, so-called ablate and pace. And nowadays, we can also do the radiofrequency ablation for atrial fibrillation. Atrial cardioversion and defibrillation is also a treatment choice for atrial fibrillation, and pacing, to a very extent, is also successful in treating or preventing atrial fibrillation. Just a word of caution. If you want to cardiovert a patient with atrial fibrillation, make sure it's a cardioversion but not defibrillation. The example that a 58 Joule shock was delivered in an attempt to terminate atrial fibrillation, but the switch from defibrillation mode to cardioversion mode was not made. That is, it defibrillated in asynchronous mode, so resulting in ventricular fibrillation, and this is very dangerous. So here's a table depicts the differences between the atrial flutter and atrial fibrillation. The atrial rate in atrial flutter is usually 250 to 350 beats per minute, where in atrial fibrillation, the P rate is usually 300 to 600 per minute. The ventricular rate in atrial flutter varies with conduction. It's the same as in atrial fibrillation. It usually appears as irregular ventricular rhythm in atrial fibrillation. So the rhythm is grossly irregular in AFib, but regular in AFlut. The typical sawtooth baseline will be appearing in the atrial flutter, but in atrial fibrillation, usually it's a sort of a waxy baseline. The underlying mechanism is different. In atrial flutter, it's supposed to be re-entry via a macro re-entry circuit, while in atrial fibrillation is a multiple wavelet re-entry or multiple or single focus firing.